Neuroinfectious disease research can encompass a wide range of items, and that includes both diagnostic and detection of pathogens that can invade the nervous system. It could be clinical manifestations, it could also be treatment. There is a large subset of individuals that are heavily focused on how the immune system, either the systemic immune system or the neuroimmune system, interacts with pathogens, so that host-pathogen interaction. Our lab is largely focused on how HIV infection affects the nervous system, and in particular how HIV infection, despite therapy, can result in neurological comorbidity that includes cognitive impairment or depression. Our lab is focused for a long time trying to figure out how immune activation or systemic markers of disease, including disruption in the neuroendocrine axis, really translates to disruption of neurological function, largely manifest into cognitive impairment or depression, which is high in the HIV population. So some of our exciting work actually on HIV, I think, is what we've identified using a large metabolomics screen is to look at people with HIV that were virally suppressed on therapy. Some of about 25% were already on antidepressant medication. Those individuals with persistent depressive symptoms when compared to individuals that did not have persistent depression. Basically to take a look and see what pathways were altered and maybe to see whether or not those could be targets. So one of those pathways that is altered was a neuroendocrine axis pathway. Our next research is to try to identify whether or not this pathway is affected in other cohorts of people with HIV, again, virally suppressed on treatment, but really suffering from depression symptoms, and essentially try to see whether or not this pathway, this axis, is something that we could use to then go further to target for therapy. I think that's what's most exciting about this piece of work is that we identified that there was a subset, women who are at particular risk for depressive symptoms in HIV. Those individuals had this particular pathway that was dysregulated. And in so doing so, our next point of research is not looking at a more broad perspective of people with HIV, but really focusing in on women who have persistent depressive symptoms despite therapy, and to take a look whether or not this could be a particular target.